Nalmefene 2.7 mg per actuation nasal spray is used for the emergency treatment of known or suspected opioid overdose. Symptoms of serious opioid overdose may include unusual sleepiness, difficulty waking up, or breathing problems. Other symptoms may include very small, pinpoint, pupils, slow heartbeat, or low blood pressure. If someone has serious overdose symptoms but you are not sure if they are due to opioid overdose, give Nalmefene right away anyway, since slow/shallow breathing may cause permanent damage to the brain or death. Symptoms of opioid overdose may return after treatment, so it's important to get medical help right away after giving the first dose of Nalmefene. This medication works by blocking the effects of the opioid in the brain. Remember to follow the recommended daily dosage and take it at the optimal timing for the best results. When you receive this medication, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. It's important to keep this medication handy in case it is needed, and learn how to properly administer it ahead of time. If you have any questions, don't hesitate to ask your doctor or pharmacist. It's also crucial for close family and household members to be aware of the symptoms of an opioid overdose and know how to administer Nalmefene if necessary. Opioid overdose should be treated immediately to prevent serious effects such as brain damage. When using the Nalmefene spray, only remove it from the package when you're ready to use it. Lay the person on their back, tilt their head back, and support their neck with your hand. Gently insert the tip of the spray nozzle into one nostril, then firmly press the plunger to give the dose. After giving the dose, seek medical help right away, even if the person wakes up. If symptoms return, give another dose in the other nostril every 2 to 5 minutes, changing nostrils with each dose. Each nasal spray contains only one dose and cannot be reused. It's important to continue closely monitoring the person until emergency help arrives and inform the healthcare professional that Nalmefene spray has been given. Some common side effects of Nalmefene 2.7 mg per actuation nasal spray include nasal discomfort, stuffy nose, headache, nausea, flushing, and dizziness. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. If someone has been using opioids regularly, sudden withdrawal symptoms can occur after receiving this medication. These symptoms may include body aches, fever, sweating, watery eyes, runny nose, sneezing, goosebumps, yawning, weakness, trembling, restlessness, diarrhea, nausea, stomach cramps, increased blood pressure, or fast heartbeat. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before using Nalmefene 2.7 mg per actuation nasal spray, make sure to inform your doctor or pharmacist if you have any allergies or if you have a medical history of any kind. It's important to also let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, before undergoing surgery. If you are pregnant, using this medication may cause opioid withdrawal in your unborn baby, so it's important to inform your doctor if you are using Nalmefene. Your doctor will be able to monitor you and your unborn baby accordingly. It is also uncertain whether this medication passes into breast milk, so it's best to consult with your doctor before breastfeeding. As for the optimal timing and dosage, it's best to follow your doctor's instructions and ask for any details you may need. When using Nalmefene 2.7 mg per actuation nasal spray, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any other medicines while using Nalmefene 2.7 mg per actuation nasal spray to avoid any potential risks or complications. If someone has taken too much Nalmefene 2.7 mg per actuation nasal spray and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. You should talk to your doctor or pharmacist to find out how to avoid opioid overdose. It's also important to educate your family members about the signs and symptoms of opioid overdose and let them know where you store this medication. When using Nalmefene 2.7 mg per actuation nasal spray, it is important to follow the dosage instructions provided by your doctor. This medication is used to treat an opioid overdose in adults, and it should be administered as soon as possible when overdose symptoms are observed. It is important to seek emergency medical assistance after using the nasal spray. The recommended dosage is 1 actuation, 2.7 mg, administered into one nostril. The optimal timing for taking this medication is as soon as opioid overdose symptoms are observed. Always consult with a healthcare professional for specific instructions and guidance on the use of Nalmefene 2.7 mg per actuation nasal spray. When using Nalmefene 2.7 mg per actuation nasal spray, it's important to store it in the original package at room temperature and away from light and moisture. Make sure not to freeze it and keep it out of the bathroom. Also, remember to keep all medications out of reach of children and pets. It's a good idea to check the expiration date from time to time and replace the spray before it expires. When it's time to dispose of the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.